ABC 10 News at 4 starts now.
The beginning to an end. The FDA throws support behind Pfizer's coronavirus vaccine, but distribution won't be easy. What has to happen next before it's shipped out? San Diegans wait for hours to get COVID testing in the South Bay. Why the lines are so long in Chula Vista. Plus, how to sign up for smartphone alerts to notify you when you've been exposed. But we begin with the monumental vote the country has been waiting for. In the last hour, FDA advisors gave the green light to the Pfizer vaccine. Thank you for joining us this afternoon. I'm Kimberly Hunt. And the panel recommended the vaccine for emergency use. As ABC 10 News reporter Jennifer De La Cruz explains, it could be in the hands of San Diego healthcare workers in just days.
We're on the brink of a breakthrough in the fight against COVID-19. The county says 28,000 doses of the Pfizer vaccine may arrive in San Diego within the next week. Sharp hospitals are now running through logistics about how to give that vaccine out once it gets here.
We do have an internal process where people can sign up to get the vaccine, the same way we do for flu.
VP of Pharmacy Services Suzanne Shea says those working directly with COVID patients in ICUs, ERs, and urgent care centers will be the first in line to get it. But distribution won't be easy.
The storage consideration is probably the biggest hurdle to get over. And for the Pfizer vaccine, that it has to be stored at -80 centigrade.
Shea says they do have a freezer cold enough to hold the thousands of initial doses they'll be getting.
The vaccine that will be stored in that ultra low temperature, then it can be moved to a refrigerator for a period of time. And that's when it'll be thawed and be available to vaccinate.
While the vaccine won't be mandatory for Sharp employees, she says there's already a lot of interest.
Over this past week, I've seen an increase in excitement from nurses, from physicians, from folks in the corporate office.
Sharp says vaccinations will take place right where the employees work at several of their locations throughout the county. Jennifer De La Cruz, ABC 10 News.
The Pfizer vaccine has proved to be 95% effective in clinical trials. It's already being administered in the UK and Canada. Here are the next steps for the U.S. The FDA is expected to authorize the vaccine on an emergency basis within hours or days. And then the CDC will vote on whether to recommend the vaccine and for whom. Then the shots will start being given out within 24 hours. States have the final say on how the vaccine is administered.
I am absolutely supportive of getting a vaccine, and I will be the first in line when I am eligible to get one. I believe in vaccines. I believe in the science of vaccines.
Pharmacists will be instrumental in getting the first round of COVID vaccines out, especially for the most vulnerable. Walgreens and CVS have a deal with the U.S. Department of Health to go into more than 50,000 long-term care facilities. Now, both companies are recruiting pharmacists, nurses, and pharmacy technicians. Once the vaccine is more widely available, people will be able to sign up online to get the vaccine at a pharmacy location. Walgreens plans to work with communities to set up COVID vaccine sites in other locations like they do with the flu shot.
We work with churches and local community centers in underserved populations to bring the vaccine to those patients that would, need them.
Now, speaking of the flu, the pandemic has brought some encouraging news on that front. Walgreens created these map models to show what the flu season has done so far this year compared to last year, and there's been far less activity. Walgreens attributes that not only to COVID safety precautions, but to what they call an unprecedented demand for flu shots, which you can still get. Now, one of the last in line to get a COVID vaccine will likely be children. That's because early trials didn't include kids. Although today, Moderna announced it is starting its vaccine trial on adolescents here in the U.S. Pfizer already started including children in October. Many health experts said that just vaccinating adults would not be enough to end this pandemic.
More and more San Diegans are rushing to get tested for COVID-19, but the wait times at some South Bay locations are hours long. ABC 10 News reporter Rena Nakano explains what's causing the backup.
Cars wrap around 4th Avenue in Chula Vista. Inside, hundreds of people waiting to be tested for COVID-19.
Testing is just something that we all need to be doing regularly right now.
Recently, the lines and wait times at the county's free testing sites have been getting longer, especially in the South Bay. Nancy Maldonado with the Chicano Federation says this area is home to many Hispanic or Latino San Diegans who have frontline jobs with greater exposure to the virus.
The other reason is the multi-generational housing and the lack of housing here in San Diego.
At its peak, Hispanic and Latinos made up 63% of the county's infection rate, despite only being 34% of the population. Most recent statistics show that number dropped to 57.7%.
It's still high and it's still alarming, but we have seen that number start to come down.
It's thanks to community organizations like the Chicano Foundation that take away the stigma of testing. They offer resources for those who test positive, support for families, even quarantine locations.
There are resources available so that they don't have to stay within that household.
But there are still some obstacles. Many people are coming here to Aquatica and they don't know about the appointment system, and that's why they're being turned away.
A lot of the county sites are switching to appointment only, but that message isn't getting out fast enough.
That's why it's important to check online before leaving your home, although making appointments is always recommended.
It's up to all of us to make sacrifices right now and to do everything that we can to bring down these infection rates so we can reopen and our small businesses don't have to keep suffering.
In Chula Vista, Rena Nakano, ABC 10 News.
The county is now working with community partners to set up more testing locations where there is the greatest need. A new tool is available to help slow the spread of the virus in California. A smartphone app uses Bluetooth technology to sense if two phones have been close together for an extended period of time. If one of those phone users tests positive for coronavirus, anyone who may have been exposed will receive an alert. The app is voluntary and anonymous. It's already on iPhones with the latest update. You can switch it on with exposure notifications. That's in your settings. And for Android users, the app is called CA Notify, and it's free.
Coronavirus is not only spreading in the U.S., it is killing. Newsfeed starts with yesterday being the deadliest day yet of this pandemic in the U.S. More than 3,000 deaths were reported. Now, you can test for COVID at home. The FDA has granted emergency use authorization to the first non-prescription, over-the-counter at-home COVID test. You can order one on LabCorp's website. You can also buy an at-home test kit from Walmart for less than $100. It is only being sold right now at Walmart.com or Sam's Club. You must have a doctor's order to take this test. You'll receive results via email between 24 to 48 hours after the lab receives your test kit.